Good evening, Dr. Proskauer.
Good evening, Brenda. Good to see you again.
Good to see you. And can you tell us what we can learn with karmic therapy and what we remember from the womb?
Yes, this is another interesting topic. Most people think that in psychotherapy you can't remember anything earlier than early childhood. You can't remember infancy, you can't remember birth, and you certainly can't remember being in the womb. But in fact, there's lots of information laid down from all those different levels. And today we're talking about prenatal memory. From the moment of conception, and even before, the consciousness that you have is associated with that little embryo and the fetus that grows out of it. And all the time that you're in there, during the entire 9 months, you're tuned in to your mother's experience. She surrounds you. Her psyche is all you know. And you are aware of her emotions, her physical sensations, and her thoughts, everything. And so her experience and the quality of it affects you, particularly so because you're not in any position to distinguish between that and yourself. You're a part of her. You're physically a part of her. You don't just make that distinction. So whatever she's going through, there's a tendency to take it on. You don't distinguish between hers and yours at this point. So let's say that your mother is depressed. For example, I know of one example comes to mind right away of a woman who during the pregnancy learned that her father was dying of cancer. And because her husband had taken a job in a distant city, she couldn't get back to see him very much. And not long before she gave birth to the baby, her father died. And she was grief-stricken not only because of his death, but because she hadn't been able to spend time with him during that pregnancy. So she was depressed during a large part of the pregnancy, preoccupied with her father, and she didn't have a whole lot to give her baby in terms of positive feelings.
Right.
Now this person who was born ended up having a chronic depression, which was very resistant to treatment by other methods, by psychotherapy and drugs. And the reason was because they were really trying to treat the mother's depression, not the patient. She was carrying her mother's depression in her psyche.
Right. Yeah.
And when we released it, and in the process of her repeating back what her mother had been feeling in her body and in what she was thinking and her emotions, and actually releasing all that she had absorbed from her mother, in that process she realized, hey, that was her, not me. She recognized what she had thought were her own thoughts and feelings, but they were really her mother's. And that was liberating to her, and she was no longer in the grip of her depression after we finished that phase of the work.
Wow, that's great.
So this is actually the place where I go when someone comes to me with a depression that has not yielded to anything. I think immediately of the prenatal period.
Great. Well, let's tell everybody that you are the author of Karmic Therapy, Healing the Split Psyche, and it's available at razorpages.com.
Yes, and in that book I go into much more detail about the effect of prenatal memory on people's lives.
Great. Well, thank you for your time tonight.
Thank you.